so they can also avail the benefits in keeping their health healthier and stronger. Good afternoon, everyone. On behalf of Manipal Hospital Malleshwaram and our speaker, Dr. Rajshekhar, I would like to thank you all for showing interest in our health education webinar program, aiming to keep everyone aware and educated so as to keep your health healthier and stronger. Thanks again for actively participating in Dr. Rajshekhar webinar. We request you to please hold for a few more minutes. Webinar will be starting shortly. Meantime, if you have any doubts or health-related queries, you can put them in chat section below. Dr. Rajshekhar will answer all those one by one at the end of the session. You can also share this Zoom webinar link to your friends, families, or WhatsApp groups so they can also avail the benefits in keeping their health healthier and stronger. Good afternoon, everyone. On behalf of Manipal Hospital Malleshwaram and our speaker, Dr. Rajshekhar, I would like to thank you all for showing interest in our health education webinar program, aiming to keep everyone aware and educated so as to keep your health healthier and stronger. Thanks again for actively participating in Dr. Rajshekhar webinar. We request you to please hold for a few more minutes. Webinar will be starting shortly. Meantime, if you have any doubts or health-related queries, you can put them in chat section below. Dr. Rajshekhar will answer all those one by one at the end of the session. You can also share this Zoom webinar link to your friends, families, or WhatsApp groups so they can also avail the benefits in keeping their health healthier and stronger. Today is a wonderful day. We have our guest speaker, Dr. Rajshekhar, consultant surgical oncology from Manipal Hospital, Malleshwaram. Dr. Rajshekhar, a renowned in the field of surgical oncology, he has done his MBBS, MS, DNPGS, DNP Surgical Oncology, FRCS, robotic fellowships, He speaks English, Kannada, Hindi, Telugu, and Marathi. So please feel free to ask your queries in your preferred language. Over to you, doctor. We can start the session.
Screen those. No, Yeah, good afternoon, everyone. Let us today know some facts and some realities and hopes, treatment aspect of two of the most common cancers a woman suffer from. They are related to uterus, that is endometrial cancer and cervical cancer. If you can see the screen over here, the uterus, the inner lining is known as endometrium. Any part of the body can go for cancerous change, and the inner lining or innermost part of the uterus, or what we say garbhakosh, that is known as endometrium. And if there is any outgrowth or tumor over there, we call it as endometrial cancer. So as you can see, this is the uterus, and the lower part is known as cervix, and this is the uterus main body, and the inner lining is endometrium. You can see some changes which are happening here. These are the changes which are happening. So what is the cause of this? The exact cause is not known, but there are some changes which happen so that the cells in the endometrium keeps growing uncontrolled, and the cells divide and they become so strong, so much mutated that they keep on growing and they keep on spreading. So what are the risk factors? Are there any risk factors? Who will develop more, means who is more prone to this endometrial cancer? Yes, if there is an imbalance of female hormones, that is more estrogen, that is irregular menstrual cycle, polycystic ovarian syndrome. In these conditions, what happens is there is a more amount of estrogen. This estrogen is the main factor where this endometrium starts growing. And the other risk factors are people who are diabetic and people who are obese. They are at increased risk. And the one more thing is postmenopausal ladies, means as the age advances, the risk of endometrial cancer also increases. And people who have more menstrual years, means the menarche has started early, that means menstruation has started earlier than 12 years of age and has lasted for more than 45 to 50 years, and it is going on, means more the years of menstrual cycles or menstrual period, the higher the risk of hormonal exposure. And some people take hormone therapy postmenopausal hormone replacement therapy, what we call it as, or else sometimes because of breast cancer, we will give hormonal treatment. These people are also at increased risk. And women who are never pregnant, they are also at increased risk of exposure to estrogen rather than progesterone. And there are some hereditary conditions like it is associated with colonic cancer. And sometimes there is a atypical endometrial hyperplasia, which can also convert into cancer. So that's a risk factor. So now, what are the symptoms? How do you detect or how do you suspect that a person is having endometrial cancer? One is irregular menstrual bleeding or intermenstrual bleeding. Means in between two cycles, you may bleed, or there may be an excessive bleed during the menstrual period. There may be a lot of clots. Then we should suspect something is wrong. And having bleeding after attaining menopause means menopause means cessation of menstrual cycle. At the age of 45 to 50 years, normally Indian woman will stop continuing to have this menstrual cycle. And 1 year, 2 years, 3 years after a gap of this, again you feel that there is a small amount of bleeding. That is an alarming sign. That is postmenopausal bleeding. And lower abdominal pain means there is some amount of discomfort in the lower abdomen. Some pain, some discomfort, which is continuous. And having watery or blood tinged vaginal discharge is also an indication of this one. There is a symptom. So now coming to the investigations, how to investigate and confirm that it is an endometrial cancer. Yes, you need to consult a specialist for that, and they will be doing the pelvic examination. Sometimes we ask for transvaginal ultrasound, and main thing is hysteroscopy. The scope is introduced into the uterus, and if there is any abnormal growth, we will be seeing that, and we will be taking a biopsy from there. So that confirms the endometrial cancer. Sometimes you must have heard a DNC, dilatation and curettage. The pictures which were shown here, first there will be the opening will be closed always, so it will be opened with the dilator, and the biopsy forceps will be introduced inside, and small piece will be taken. So that will tell us that yes, this is a confirmatory cancer. And how do you stage? What are the stages? Always in cancer we have 4 stages. When it is only to endometrium, we say stage 1, and means that the uterus, we say stage 1. If it goes into the cervix, the lower part of uterus, then we say stage 2. And if it goes beyond the uterus to the parametrium or ovaries, we say stage 3. And when it goes beyond the pelvis, we say to the other organs, we say stage 4. So that is this one. So what are the treatment options? Most of the times endometrial cancers are detected early because of irregular bleeding or heavy bleeding. So that's a good thing, that it can be detected early, or most of women come early. And options are 4 standard therapies. One is surgery, radiation, chemotherapy, hormone therapy. Majority of the times early cancers are treated by surgery, and majority times it is curable. Stage 1, stage 2, most of the times it is curable. So the catch here is coming to the doctor at a very early stage. So surgery can be open, laparoscopic, or robotic. And if at all there are some aggressive features in that, then we subject after the surgery for a radiation treatment. It can be external beam, or it can be internal, what we call brachytherapy. So these are the 2 types. And chemotherapy, if at all it is advanced, it is stage 3 or stage 4, then we use chemotherapy. Chemotherapy is nothing but injections or tablets being given. And hormonal treatment we give when it is very early stage, and there is an important aspect like still woman didn't have children, so we want to preserve the uterus. In that bridge gap, we give hormone treatment so that she can conceive, have children, and immediately after that we treat it. But this is not a definitive treatment. It is, we are just buying the time. So these are the 4 modalities of treatment. Majority of the times endometrial cancer is curable. So if at all there is any heavy bleeding or postmenopausal bleeding or intermenstrual bleeding, please consult your doctor. So we will be definitely able to cure it. Okay. Yeah, this is all about endometrial cancer. Now I'll be briefing about cervical cancer. Yes, this is also a cancer related to uterus, but the lower part of the uterus. The previous cancer was inner lining of the uterus, that is endometrial. This is the lower portion of the uterus. This part is known as cervix. So if at all there is an overgrowth of this part, we call it as cervical cancer, because this part is known as cervix. Now next is, what is the cause of this cervical cancer? Until recent past, cervical cancer was the most common cancer in a woman. Now it is breast cancer. And even now, the most, if you take the numbers, we have the highest statistics, highest number of cervical cancers in India. And fortunately, recently we have identified that it is caused by the human papilloma virus infection. In cervical cancer. And what are the risk factors? Which women are more prone for this cervical cancer? One is smoking and HIV, human immunodeficiency virus infection. Even those women are at increased risk, and women who smoke, and women who are taking birth control pills for more than 5 years or so, and multi-para, what we say, having given birth to many children, more than 3 children, and having several sexual partners, because the chances of viral infection increases. So that is why those women are also at increased risk of having a cervical cancer. So what are the symptoms? When we should suspect that there is a risk of cervical cancer, or I may be developing cervical cancer? There will be a small amount of pelvic pain, constant pelvic pain, or sometimes bleeding. Bleeding can be intermenstrual bleeding, or bleeding, excessive bleeding during menstrual period, or bleeding just before or during or after intercourse, sexual intercourse, or there can be vaginal discharge, which is foul smelling, or sometimes may not be foul smelling, but still it continues to come even after taking antibiotics. And the other things are, sometimes you may have increased urination, increased urge to micturate, or there can be some bleeding in the motion, what you call bowel movement, and sometimes back pain if it is growing into the back, and sometimes in a late cases there can be a leg swelling. That is because it might have grown beyond the cervix and may be causing obstruction to the ureters. So early signs, most of the times it is mild discharge, mild pelvic pain, and bleeding. So anytime you have this, please consult a doctor. It don't have to be cancer always, but still we want to rule out the worst. And how to diagnose this? A doctor will first do the pelvic examination. If at all there is a growth seen on the cervix, then a punch biopsy will be taken. That is a small tissue from there will be taken and sent to the lab for confirmation. If at all it is not clearly visible, very early cancers, then we do colposcopy. That's a microscope magnification. We see in the magnification, and then we take the suspected area, small biopsy, and send it. And in a proven case, we want to know the extent of CT scan. So that will stage the disease. So what are the treatment options? Cervical cancer is very much treatable in stage 1 and stage 2 and early stage 3. The main modalities for all cancers, and including uterine cancers, or surgery in the initial stages. If it is stage 1 or early And sometimes when they are very advanced, we may go for targeted therapy. Each treatment will be given according to the stages, so that will be decided by the doctor. The best part of cervical cancer is we can prevent it. Very few cancers we can really prevent it, and in among them, the cervical cancer tops the list, because there is a fantastic simple screening method which is available, that is known as Pap Smear, that can be started at the age of 21 years itself, and it should be done once in 3 years. And that goes for up to 29 years, and from 30 to 65 years, Pap smear can be done once in 3 years as usual, from 20 to 29. But there is one more special test available here, that is known as human papilloma virus test, that is HPV test, because it is the virus which causes cervical cancer. So if you test this, then once in 5 years testing is also enough. And we can do both Pap smear and HPV test. That is also once in 5 years should be enough. And if at all a woman is older than 65 years and she is subjected to all these Pap smear test and HPV test before 65 years and they were consistently negative, probably we may stop doing after 65 years. And if at all she has not done before at all, then probably we have to do it once in a while. Otherwise, this woman who are already having undergone hysterectomy, where uterus is already removed, means cervix is already removed, we don't suggest this test. This is about screening, which will detect the cancer very early. And there is a fantastic news about cervical cancer is we have vaccine. Very few cancers have vaccines where we can prevent cancer from occurring at all, and one among them is cervical cancer. So this can be given between the age of 9 to 26-year-old females, and usually we say 10 to 11 years or 11 to 12 years girl can start taking this. If at all it is taken at an early age, means 10 to 12 years, only 2 doses are enough. At an interval of 6 months, 6 to 12 months, 2 doses of vaccines are enough. And if at all we give very early, at around probably 9 years, probably we may have to give 3 doses, and this is enough. And because most of the cervical cancers are caused by human papilloma virus, we have 80% chance that this cancer will not occur, because some HPV infections, rare infections can come in, but majority or most common HPV infections can be prevented. So vaccine prevents 6 types of cancers, because this HPV not only causes cervical cancer, it causes some other cancers like oropharyngeal cancer, like some warts or penile cancer. All these can be prevented by taking this vaccine. So this is a fantastic thing. But in Indian setup, even government has approved up to 45 years. Ideally, it is taken before first sexual intercourse or first exposure to the human papilloma virus. But nonetheless, it can be taken if it is not taken before, up to 45 years. But protection may not be to that level of not exposed females, but definitely there will be some amount of protection for the papilloma viruses which you are not exposed at. So that prevention can be done. So I would urge all the females in our country, in our vicinity, please advise or encourage or take yourself this vaccine. This is a wonderful, this one which we have got in cancer, which I think majority, 99% of the cancer doesn't have this luxury of prevention. So we were able to identify what is the exact cause for cervical cancer. And yes, vaccine is there in the market. There are 2 brands available. Please take it, Cervix and Gardasil. Take it and prevent it, and also spread this news to others, so that many women, mother, whether it is sister or wife or anyone, can be prevented from this dreaded disease. Thank you so much. If at all you have any questions, please let me know. I'll answer that. Yes.
Thank you, Doctor. Doctor, we have few queries from our participants. You can find in the Q&A section.
Yes, yes. Yeah, someone has asked me how long does it take to reach stage 3 and stage 4? Usually it will take 1.5 to 2 years for a cancer to reach stage 3 or stage 4. And yeah, let me take one by one question. What does the string of IUD remain? Why does the string of IUD remain on the cervix and not removed? Yes, to remove that, it is very easy if there is a string. So that is why it is kept over there, so that when we want, we can easily remove it. And we also know that there is a string inside, because sometimes some complications can occur. IUD may traverse some other way and go beyond the uterus, or there can be a pregnancy with that also. There are so many complications which can happen. So we know that IUD is there, and we can easily solve the problem. How long does the cervix stay open after ovulation? See, this all depends on hormonal. This one, we say it is not like ovulation has happened, cervix will open up. It is not like that. The mucus over there becomes very slimy, and if at all there is an intercourse during that time, the sperm can enter, but it doesn't mean that cervix is open and the infection can enter like that. It is not. The infection enters through the mucosa, it makes its own way. And does the tissue removed from the cervix during colposcopy grow back, or does it stay missing? No, don't worry, the tissue taken is very, very small. That doesn't change any of the anatomy or function of the uterus. So we don't have to worry about the amount of tissue removed during biopsy, during colposcopy. It's very, very minimal, very minimal. And what is the role of cervix during birth? Yes, cervix, when baby starts growing in the uterus, initially it grows in the upper part of the uterus. Lower part of the uterus is known as cervix, and which remains closed. So that is, it's a door. So it protects the baby. Only during last trimester, when the mother is about to deliver, the tip of cervix starts opening, so that keeps protected. So it's a very important organ for complete full-term pregnancy. And if we take HPV vaccine, will there be any side effects? No, I have not seen any side effects till now, and it is not reported also. For 27-year-old girl, which HPV vaccine should we take? See, both vaccines are good. There are two brands available in the market. One is Gardasil and Cervarix. Whichever is available, please take it. Both are very good. And if at all you can take polyvalent, where now 9 HPV vaccines are 9 HPV virus strain is included. That's a better one. Penta polyvalent. And what's a normal amount of fetal movement at 22 weeks pregnant after a cervical circulation? See, this is actually not related to cancer, so I would better avoid this, because I'm not a specialist in this. It is better answered by a obstetrician. Sorry for that. Is cervical cancer hereditary? Very, very rare that we come across hereditary cervical cancers. So I don't think endometrial cancers, yes, we have a genetic related, as I said, the colonic cancer, HNPCC, that is known as Lynch syndrome. But for cervical cancers, as of now, we don't have any related genetic genes related to that. So we don't have to worry about that. It is not hereditary. Why cervical cancer will occur after 8 years? It takes time for the each cancer from one cell to become multiple cells and grow out of control. And it is not like 8 years. That is why, see, it is not 8 years. Once in 3 years we do Pap Smear test, or once in 5 years we do HPV test, because during this period it grows. It is not 8 years, or a period of 4 to 5 years it grows. So once it starts, it keeps on changing. So I am 45 years old. Can I take that vaccine? I think you are on the before you get exposed to the human papilloma virus infection. And obviously it is transmitted because of sexual intercourse. And the will it help? We take it after 40. As I said, yes, as the age advances, because multiple human papilloma virus infection already a woman will get in. So it may not protect as a girl who has taken at an early age, but there will be some amount of protection because there are so many viruses, types of HPV viruses. All viruses you might not have got infected. So that is there will be some amount of protection with this polyvalent vaccine. And even if you have no symptoms, should you get screened? Yes, screening is nothing but detection of a cancer when you don't have symptoms. If you have symptoms, it is not screening. Then that means you need to show to a doctor. When you don't have any symptoms, even then you go and check up. That is known as screening. So please get it, because we can catch cancer at a very, very early stage. So definitely we can cure it. Means cure rate is that time 100%. So how body weight management is important to avoid this cancer? Yes, endometrial, as I said, endometrial cancer is related to obesity. And if we lose our weight, every woman, I say, that is why as the age advances, we tend to put on weight, particularly after childbearing. Means a woman has got children, so she tend to put on weight because of hormonal changes. So every woman, I advise, please take 4 to 5 kilometers of brisk walk where you sweat every day. At least you keep yourself 45 minutes to 1 hour. That will make a lot of difference in your health. Yes, I hope I have answered most of the questions. If at all someone has got any more questions, please, I am happy to answer them.
Thank you, doctor. Doctor, we have a query from our participant.
Yes.
If someone is vaccinated for cervical cancer, but later in age, if the same person gets uterus cancer, will that avoid spreading to cervix?
See, there are two types of cancer. We should not get confused. One is endometrial cancer. One is cervical cancer. Endometrial cancer causes are totally different, and cervical cancer causes are because of this virus infection. So if at all already immunized, means you are unlikely to get cervical cancer. 80% of the times you are not likely to get cervical cancer. Endometrial cancer, yes, you are liable to get.
Thank you, doctor. We have our one more participant asking, my
Yes.
daughter is 15 years old. My daughter is 15 years old. How
Yes.
many dosage of vaccine is required to her?
Yes, 2 doses of vaccines. If at all she is still within 15 years of age, then two doses is enough. If she has crossed 15, probably 3 doses should be enough.
So also the participant is asking, is early menopause increases risk of cancer or can be avoided by any precautions?
No, you don't have any control over that, except that you have a regular brisk walking, means decrease the obesity, because even fat will produce estrogen. So in turn, that is a stimulant for cancer. Other than that, you don't have direct control over the menstrual cycle. And if at all you have early menopause, actually it's a good thing that you avoid the risk of endometrial cancer and also breast cancer. Both are more common when menstrual cycle is there for 45, 50, 55. Some women will bleed until 60 years. They have more risk of cancer, not early menopause.
Thank you, doctor. Thank you, doctor, for your valuable time and sharing your views on cancers. Thank you all for joining the webinar. For booking appointments, contact details will be shared to you via SMS and WhatsApp. Also, we would like to inform you can now avail 30% off on regular health checkups on Wednesdays. So for booking appointments, contact details is shared on your screen. Thank you.
Thank you.
Thank you, doctor.